Welcome to another episode of the HealthCast. I'm your host, Phil Zappone. I'm really excited today to have John Oberg with us. I'm not sure where to begin with your credentials, John, but I was impressed across the board. We have a founder, CEO, board director, advisor, professor. Excited to get started. So welcome, John.
Thanks for having me.
Tell us a little bit about your background and how, from a business world and how you got to where you are today.
Yeah, sure. So I'm careful to introduce myself in the healthcare circles as Dr. John Oberg because my doctorate is in social work, and so people often mistake me for a physician around the hospital or in the medical practice. But I work in the behavioral health side of things, and so I got here a lot by accident. I started working out of college in a small mom and pop organization based out of New York and did some good work there, and then went on to work inside of a consulting firm. I did some work in technology along the way, started some companies. I had one tremendous failure where I flew the company straight into the ground at speed. That was a fun ride. Looking back, it wasn't so fun at the time. And then had a couple of startups where we had some nice exits. And now my partner, Dustin Williams, and I have found a way to reverse type 2 diabetes with great efficiency across lots of really hard to treat patients. And so we're really leaning into, in the medical practice, how do you help people with metabolic disease reverse things like diabetes, hypertension, cardiovascular disease? And then in my consulting practice for 20 years, it's been about people and performance. Like, how do you help people have great relationships that lead to the outcomes they're looking for, whether it's personally, professionally, whatever the case may be. And for me, I'm on the behavioral health side, so all that kind of fits together. It's like, how do you help people behave in a way that's consistent with what they want to get out of life?
Yeah, a common theme I keep having both in the clinical setting and in these conversations I've been having lately, behavior modification. And it can be challenging. I really like this quote I saw on one of your, I believe on your website. It was helps leaders and organizations create growth through better relationships.
Yeah, that's right.
Yeah, I think that might be something that we're lacking. Maybe I still say sometimes, post-pandemic world. And I think at least in the clinical setting, as much as I'm exploring AI, people still want human contact and relationships. So I thought that was great.
The Surgeon General agrees with you. He's been saying for a long time, since before the pandemic, that the number one problem in our country is a pandemic of loneliness. And so if you look at, I can't find the studies, but directionally, I've heard that, people had, 10 or 12 really close friends, men in particular, they could talk to 50, 60 years ago. And today that same number by the same kind of definition is like less than 3 or less than 2, depending who you talk to. And so it's the level of kind of what I'll call non-romantic intimacy or closeness is a lot less today than it was in kind of generations previous to me. And so I really hope to kind of change that. I want to help people find that comfort in the closeness to other people in a professional and a personal setting that's not just a romantic setting.
Sure. Did you say 10 to 12, 50, 60 years ago?
Yeah, it was a big number.
I have nowhere near that. I'm a busy guy. I'm dad of 2. I'm in my wife's clinic here. I work at the local hospital. I have this business that I'm exploring. So I'm busy, but nonetheless, I definitely don't have that number of relationships of people I could lean into.
Yeah, I think that life was maybe arguably a little less complicated 60 years ago. I think people stayed in their company for longer periods of time. So that was more of a community in kind of the industrialized age where things were a little bit less transient from job to job. And there's a lot of things that lead to that. But I think that in relationships, they take energy to work at. And if you invest in those relationships, like, they really can work out.
Yeah. It's something my wife and I talk about. Taking ownership and how to nurture our social life in a healthy way, and as much as we love being parents, but not being hermits and stuff like that. So in terms of your responsibilities, I was just really impressed with you, John. Percina is one of your companies.
That's right. Yeah, that's the medical practice that's helping with chronic metabolic disease.
I guess I'm trying to frame my question. So then there's also Sedera, and then you have a consulting business to help businesses and business leaders grow. How is your time divided among, which one of these is top on your list?
Yeah, Percina takes, I'd say, is the first focus, and kind of working inside healthcare. And I sit on a hospital board, and so I think healthcare is a big part of that. And then inside my consulting practice, I consult with some healthcare and some non-healthcare companies, and I take on those clients inside my consulting business in a very kind of special way. Like, I'm pretty choosy about who I take on as a consulting client, which is a nice place to be in at this point in my career. But really, tell my team at Percina, like my big focus in life is how do I help 1 billion people have a better life? And I think that one of the ways that we're doing that is with Percina. And then inside the consulting business, we've done some work writing books on leadership that, in some niches that are really important to us as well. And so, but again, it's all about it's the same stuff. It's how do you help people behave in the way that's going to get them what they want in their life.
I love it. I love it. Making a difference in the world. Does Percina manage stuff in addition to diabetes? Or I know I heard you verbalize hypertension. I think you said cardiovascular disease.
CHF, yeah, CHF, COPD, asthma. If you look at kind of the way that we treat type 2 diabetes and hypertension and CHF, that same methodology of treatment also works for COPD and asthma. And there may be some other conditions that it helps improve kind of secondarily as well. But if you look at kind of the numbers, yeah, so for people who don't know, like if you have a drug that reduces kind of hemoglobin A1C by 1% in a year, you've got a pretty successful drug. Our patients see reduced hemoglobin A1C of like 1.6% per month. So not 1% per year, but like 1.67% per month. And so we're taking people, so we're doing really kind of radically different work. And if you talk to clinicians, like, our latest study that we're about to publish shows A1Cs that, an average starting place of 11, which how bad that is. And we get them to like 7.2 in less than 6 months.
Yeah, some unheard of. I have that individually. I don't have that as a community. That's or as a collective response, and that specifically through. It sounds and Dr. Peter Teja's that the book Outlive was saying that on the cusp we're being on the cusp of medicine 3.0, where instead of being reactionary we're proactive. And I think what you're saying here is, if I'm reading, that we're putting patients in the driver's seat and being accountable for their choices.
That's right. Yeah, a lot of patient agency with what we do. That's really highly important to the process. We use lots of medicine, lots of devices, like everything in the world that's kind of the most cutting edge stuff we use. But the most important thing is the relationship between the provider and the patient, and how the patient and the provider choose to navigate that world together. And so it's not enough for the patient to kind of do what they want to do or have the doctor say, you have to do this thing. It's about having the patient and the provider work together to create a plan that the patient's committed to and bought into. And then when it doesn't work, they work together to make the plan work for what the reality of life is. So it's not letting kind of perfection get in the way of good.
Is it remote patient monitoring and me?
Yeah, we use RPM, RTM, all that stuff happens inside of our practice. And so, but more importantly, like when a patient's plan isn't working, they'll just call in and we make changes. Like there are some patients that we've actually titrated their insulin every 72 hours until we got it right.
Yeah.
But you have enough data points after 72 hours to make changes. And I think most providers know that you can do that. And some might even say you should do that, but most of them don't have the kind of business environment to make that possible from a bandwidth perspective. And so we use things like AI to give our providers much more bandwidth so they can really lean in with the patient.
Yeah. Can you expand on that a little bit?
Yeah. I mean, so you just look at I think there's some simple things like, ambient scribing that lots of people are using. That's a vanilla use case. For us, we have AI that kind of takes in the entire patient file from all the places they've been, hospitals and labs and all this stuff. And then it points the providers to the chart things that matter for what we do. And then I tell people we do crazy stuff. Like our providers read the patient's chart before a visit.
Yeah. Right.
Just crazy things,
Right. Yeah. And Percina's impact, is it just limited to your community and your larger region? Is it out beyond Texas?
Yeah, right now we're licensed in California, Texas, Oregon, Florida. I think we're about to be licensed, momentarily in Michigan, New Jersey, Colorado. We'll be in 50 states pretty quickly. And it's all telemedicine for what we do, because we don't take the role of a primary care provider. We don't take the role of a specialist. We don't take the role, like we support the specialties and the primary care providers that already exist. And we just are like glue. We just flow into the gaps and help the primary care provider be better. We help the cardiologist be better. We help the endocrinologist be better. We don't try and take on their role.
Okay. That's cool. Let's expand it with Percina beyond diabetes. Throw me some other stuff out there, like say hypertension.
Yeah, and hypertension is the same thing. You have medicines that are being used for hypertension. You'd know them better than I would, where you go in and you have to titrate those medicines based on how a patient's feeling and what's going on with them, what the side effects are, and you've got to dial it in. And so the same thing with CHF. Like if someone's weight goes up dramatically, there's a certain threshold where they should be, using more diuretics as an example. And so we're able to pay attention to those things and then check in with the patient more frequently than waiting for that 2-week or 2-month or 6-month visit and say, hey, let's go ahead and make that shift. Like, how are you feeling? And that way patients don't self-medicate by trying to figure out their own medicines in ways that are sometimes really difficult for them.
It sounds awesome. One of the things that I bump into with my patient population is working at a small rural hospital, we have difficulty keeping staff. We have high turnover. And as such, we're a busy place. It's hard to get follow-ups unless you have an acute issue, as opposed to say ongoing management. It's hard to have consistent visits to see real progress.
When we have rural doctors will say things like, hey, could you make sure this patient gets in at 3 months and this patient gets in at 6 months? And because we're talking to the patient so often, we follow up and make sure. It's like, hey, by the way, have you seen Phil lately? No. Well, Phil wanted you in 90 days. We're at 82 days right now. Let's call his office and see if we can get you in 8 days from now. And so we drive that relationship the PCP wants, or the cardiologist, and so we actually help to not get in the way of that by understanding what those doctors want, what they want the follow-up regimen to be. And sometimes we'll call the PCP and say, like, hey, look, we think this is the right medication plan. What do you think? And occasionally the PCP is like, hey, let's do this instead. Most often they say, yeah, that's perfect, let's do that. And that's great too. But we're here to make a community out of it, not to compete in the community.
Yeah. Talk to me about Sedera a little bit. Is it healthcare for people who can't afford healthcare? Is it
Yeah,
I don't think I'm exactly clear on it.
Yeah, so Sedera is a medical cost sharing community that was acquired by Health Admins a couple of years ago, and I'm on the board with Health Admins today as part of that transition. Healthcare sharing is great. It's like if I don't have insurance and I want to share the needs of other people, I might commit to saying, hey, look, I'm gonna join as a member. I'm gonna pay $600 a month as my membership fee, and then if I have a catastrophic event, the membership is gonna come alongside me and help me with my medical bills. And so it's a non-insurance way. Some people have heard of healthcare sharing ministries. It's similar to but different than a healthcare sharing ministry. And so it's a way that people can come alongside of each other in a non-insurance mechanism, and then share one another's burdens.
In terms of your consulting, what is your either bread and butter or your ideal client that you at a point now where you get to have some choice over who you're working with? What are some ideal clients you look for, and who are the type of people you're working with?
Yeah, I think it's generally the leaders of organizations that are generally speaking, $20 million to $1 billion in revenue, but it's people that are interested in growing themselves as leaders, and generally they want to grow or scale their company, and they're interested in the systems and processes that can make that growth less work. It's like, how do I go out and figure out what people already know and not try to learn it through trial and error, because I want to go through that process more quickly with less pain. And some people want to do that focused on the growth of their company, and that's the number one goal. Others, they want to focus on, like, how do I balance this with my lifestyle, and that's the goal. In either case, it's like, how do we kind of get again, I'm going to say this kind of like a broken record. It's like, how do we get your behaviors lined up to what you want to do? The thing we don't want to do is have people say, I want this thing over here, but then act like I'm going to get this thing over there. Like, creates a dissonance that's not very helpful for people.
I wonder, just coming from left field, I wonder if there's overlap from your perspective as an expert in human behavior with improving patient outcomes and maybe improving business outcomes, and if there's
it's the same stuff.
Common role, and such.
Yeah, humans are humans and have been for a very long time, and the environment changes over time. So you have to be, aware of kind of a dynamic environment, and different people have different environments, and cultures and subcultures and social norms and all those things. But at the end of the day, I think, I'm a social worker by training, and so I look at, like, there's the policy level, like macro level things. There's the meso level, community level, company level, like things. And then there's the micro level, which is the individual. And so, one of the things we talk about is, like, the policy level may be really difficult. And even large companies may provide an environment that's not perfect for you in your opinion, but as the individual, what can you do to make the company or the meso level better? What can you do to make the broader community better? Like, what do you control? And how do you take that agency to make it better, despite you might not be in the perfect environment, and maybe you want to get to a better environment over time, but what can you do right now today? And so people having that level of agency, I think they feel a lot of, reduced anxiety, and they're excited to kind of be able to take that level of control and make things just a little better and a little better. I think once you have that kind of inertia changed, people tend to do better at getting what they want.
Sense of ownership too, probably.
That's right.
What are some of the successes that you're most proud of with your companies?
I mean, helping, like, I can think of, multiple occasions where I've helped someone get into their company and then sell their company successfully to kind of get to their financial finish line and help them transition from one season to the next. I love it. I've had several successes where we've had kind of one generation of the company hand the company over to the next generation of ownership, and that's been, really satisfying. So I think having people, choose their goal and then hit their goal and then transition to the next kind of path is really enjoyable for me. And that's true on the Percina side too, where you see patients that transition from kind of like, we get a lot of patients that are like in the hospital, they come out, they're sick, they've had 10, 20 years of disease, uncontrolled, and 12 to 18 weeks later, it's controlled for the first time in a decade or more. And they're like, wow, I haven't experienced this. And there's so much more hope around that. And so those are the really fun stories to talk about.
Do you have much patient contact, or is yours more from a broader view?
Things get escalated to me when we're having, our team doesn't know how to intervene, they don't get into it. And so on the behavioral side in particular. So I've got lots of stories where I've had to intervene with patients to kind of help out in some of the stickier situations.
How about some challenges that maybe have been difficult, or challenges that were overcome?
Our biggest challenge right now is that, we work in a space that's really noisy. It's a very busy space with lots of revenue for lots of companies and lots of marketing and competition. And so where we focused a lot on the clinical outcomes, there are lots of people who have got beautiful marketing and really great messaging, and they've been saying they can fix problems for years that they're not fixing as effectively as we are. And so it's like a little bit like the David and Goliath story, right? Like we've got to get out there and get our message out to the world more broadly. But it's hard when you're talking about these billion-dollar companies that are also selling something that has some benefit. It's not like they're not beneficial, but they're not is focused on the clinical outcome in the way that we are, getting the types of results we're getting in the same way. So that's been a real marketing challenge that we have to face and lean into, and accept that we're not experts in that marketing, and we're going to need to really lean into that in the near future.
Getting the word out on what services you offer and why yours are superior to others.
I was joking with people, like when I tell someone what we do face-to-face, doctor to doctor, like everybody wants a second conversation. But when I send someone a piece of paper that says what we do, I'm exactly 0% successful at getting a conversation, because they've heard something so similar for so long. It didn't live up to the expectations they had, that it's just been like, so 100% over here, 0% over here.
It sounds like they connect with you, but maybe the message might sound similar to other companies, but maybe they connect with you well.
I joke with people, I am as bad at marketing as I am good at helping people with diabetes. I gotta figure out that skill set.
How about what are some trends that you're seeing on the horizon that you're anticipating for growth?
Yeah, we're pretty deep into the AI space, and so we're deploying AI as fast as any organization our size that I'm aware of, and we've partnered with Salesforce to use some of our AI. And so like one example, we were the first company in the entire world to deploy a couple of their AI agents. It was Salesforce deployed it, and they allowed our company to deploy it second. And so right behind them, and then we're writing AI. Like there's things we're doing on the clinical side that no one's going to write that level of clinical AI, so we're doing it ourselves. And so we've got this really nice blend of like off the shelf on the platform with Salesforce, plugging our stuff into it, putting it all together, and getting really great outcomes across all the functional areas of our business. And so we're pretty excited about what that can mean for reducing the cost of care over time, and then giving our providers more time with the patients, not less time. So I think there are some people that want to kind of put AI in front of the patient. We take a different approach, which is like, hey, if the patient wants to be involved with the technology and they want to use AI to look into their chart and get prepped for we'll set that up for them, no problem. But if they want to talk to the provider, then we're going to make that really easy for them.
One of the nice things I've been having as I've been exploring this arena here, these conversations, is that I wasn't sure where the place of AI, and I'm hearing the focus on improved patient outcomes and maximizing time, like human face-to-face time. It's not about replacing humans. It's about working more efficiently.
Yeah, I think there's probably a world in the very near future. Like I've told our team, like I want to be a zero keystroke chart in very, very near future. So I think within a period of months, not years, we're going to be at a zero keystroke charting system where our providers can interact with the chart without any keystrokes at all natural language, all voice controlled, if they want to. Now, if they want to jump into the chart, they'll be able to use keystrokes. Like we're not going to stop them from doing it, but we're not going to require that. And so it's going to save them just an immense amount of what I think is called New World pajama time, where you're doing your charts in your pajamas, which is not cool, but happens pretty regularly.
If you could fix one thing, either increase revenue, save time, or cut costs, what would be the biggest thing? What's the biggest priority there?
Yeah, for us, it's revenue. We want to see more patients because we want more impact. And so we've been really focused on handling every single patient with like the right clinical approach. And now that we have those approaches kind of locked down, our second clinical study we just completed, the data set is really amazing looking. Now we're ready to start scaling it.
So how does that work for Percina? Because I see the information for providers, for patients, for payers. So if someone wanted to spread the word on Percina, is it like, let's say somebody here, we have lots of Texans that live here in Pagosa Springs. Could someone reach out to your website, someone on
Yeah.
your staff, and say, yeah, my family member in Austin has had great outcomes. I'm interested in using this, or are you trying to sign up a clinic?
Yeah, my perfect role would be to take the healthcare payer systems, the insurance companies and the hospitals, and say, hey, look, come work with us. Like, that's the easiest, best way for us to move forward. But if a patient reaches out, we have patients that reach out to us directly every day. And so I would say that whether it's a patient, a loved one of a patient, if someone works for an insurance company or a payer, self-employed company, and they want to reduce costs and make for better, that's great for us too. If they wanted, and if someone's with a hospital care system and they're discharging patients that are high, frequent flyers where they're in regularly, like we help with that too. So give us a call. We'll collaborate and see if we can be the glue for some part of the system that's broken. We've consistently built a very flexible practice on our side to fit and fix metabolic problems for payers, providers, and for the patients, all three.
When was Percina formed?
We started the medical practice in 2021, but I started my doctorate in 2020, and we were doing clinical research even before that.
On behavior, on how to change diagnosis outcomes and human behavior.
Yeah, our START protocol, which is systemic therapeutic alignment and rapid titration, involves everything. So it involves medicine and how to titrate the medicines rapidly. It's about how to get the right devices in play. It's about how to have the right eating and the right movement, exercise, right? So it's really all of those things in the order that works best for the patient. So it's not one thing, it's really everything, which is the hard part. Like I was talking to a medical doctor recently who's like, how do you train physicians in all of this? And I said, it's a little bit like neurosurgery. Just because you understand the biology of the brain doesn't mean you understand how to be a great neurosurgeon. Like you have to go to special school to become a neurosurgeon. You go through residency and fellowships and postdoc fellowships maybe. With us, our team is in training every single week, learning about the psychology of behavior change on the physician and APN side. And then on the other side, we have mental health practitioners. They're learning about the medicine so they can know when to call a doctor or an NP in. So everyone's having to learn more about the other side so they know it's like, hey, here's where I need to raise my hand and ask for help from a different trained professional inside my practice. And here's when I need to go outside the practice to ask for a cardiologist or a primary care physician or endocrinologist, whatever the case may be.
That's great. More fluidity amongst those involved.
That's right.
What does the future look like for Percina? It sounds pretty exciting from this perspective. I heard growth, revenue being the biggest driver and the biggest focus. How does the future look for Percina?
Yeah, I think it's going out and just getting really broad recognition of what we're doing so that we can go to self-employed companies and insurance companies and help them reduce the cost of healthcare. That'll help them as a company. It'll help their employees who are our patients have more money in their pocket at the end of the day. It'll help us control chronic disease. So we're taking a pretty holistic approach about how do you really look at chronic disease differently across the entire ecosystem to reduce cost, reduce treatment burden, and keep people healthier longer so you can have better health span. And so if you know Peter Attia, you know health span. And so we really believe that our job is to get people from kind of those high acuity situations into the place where wellness is a real conversation.
These conversations aren't taking place in my healthcare world, but they're much needed.
If you have conversations you want to bring us in. We're certainly excited about having conversations. We love working with rural hospitals where we can say, hey, how do we fill a gap in your community? We think that, this is a real problem. And if you look at even just the economics of a human 30 years ago in the 90s and how much discretionary income they should have today based on the rate of the economy's gone, it's been taken up maybe inadvertently by hospital administration, insurance administration, provider administration. It's not even compensation for the provider. So how do we use this promise of AI to wring all of that administration into a reasonable set of costs, put more money in people's pockets, help them get healthier? Let's move forward.
I've worked predominantly my career in rural medicine, and I've loved that's just because that's where I grew up in New England. I grew up outside of Boston, but been out west for over 20 years, and I've just gravitated to these communities that are smaller. And I think one of the identifiers that might circle back to what we're saying here is something that's always been clear to me is a sense of self-reliance. So maybe now we need to take that emotion or that value and apply it to how people manage their health. One of the things I talk about in the room is that I tiptoe around politics, but I say that, healthcare, health insurance can be challenging. How about changing our perspective to taking better care of ourselves and our families, putting people in the driver's seat? And I think that's what we're saying here with Percina, changing behavior and giving people a set of tools that work for them.
And given their exact circumstances, right? Like there are some people that are in circumstances they may not like, but if those are the circumstances for now, like how do we help them move inside those circumstances? And how do you have an expert help with that? Like, I think it's one thing for someone to be entirely self-reliant, which kind of leads us back to that epidemic of loneliness. But how do you give someone agency along with the expert to move them along? Like if you look at professionals in any endeavor, acting, they have acting coaches. Sports, there's 1,000 sports coaches. Musicians, they have tons of people helping them out. Amateurs don't have help. So if we want to be expert about our health, we need to learn how to use the experts, our providers, in a really good way, and how to help us navigate all of that. So you don't have to do it alone. You have to have agency and lead the charge. But how do you get the expert help so that the patient's not like asking questions that are silly about things that we knew in medicine 20, 30 years ago? It's like, let's get them up to the frontier of knowledge. Let's help them make an expert plan, but let's make that expert plan something they can actually do. Because if your patient's eating Captain Crunch every morning and you say, well, you've got to stop eating Captain Crunch and start eating kale, that's not going to happen. And so like, let's get them from Captain Crunch to Honey Nut Cheerios. Like, let's just let's take a little step. We talked to one patient, it was just about changing their coffee creamer.
Meeting them where they're at. Yeah. And I like what you said about good, not perfect. I think we see that. I think, as a culture obsessed with Hollywood and stars and beautiful people, male and female, that's all wonderful. Can we, I'm not asking you to change the world. Can we just do this? Can you just drink a little more water? Or if they don't want to exercise, I like to exercise. Can you just park a little further back when you go to Walmart, the supermarket? Can you just park a little further? Can we thread exercise throughout your day?
We talk a lot about readiness for change too. It's like, so that START protocol has a whole readiness for change component where our team knows about motivational interviewing and how to actually move toward commitment. And it's not just the logical, but it's the emotional buy-in to what's going to happen next, and then the positive reinforcement that happens alongside of that. Like we think that this is going to end up being a new field of medicine. It's like implementation medicine. I don't know what we're going to call it, chronic metabolic disease, implementation medicine, whatever we're going to call this. But like, how do you implement the solution? And it's not just knowing; it's actually being committed to emotionally, and that means getting the right emotional commitments. And that's where it takes both a really well-trained provider and a patient to do that. And so, yeah, that's the future.
I would think too, even that one point you just said of patient and provider, human relationship, and we started the conversation talking about loneliness, having a rapport with people. I'm more successful when I have a trust.
I think, well, that's true of anybody, right? I think that, and then knowing how to build trust. Like there's people we naturally build trust with, and there's people that it's harder. And so teaching our providers, like the easy ones are the easy ones. That's not why we're training you. We're training you for the hard ones.
Yeah. John, thank you so much for coming on our show and for being a participant in the HealthCast. If I'm directing people to any of your, I know johnoberg.com and Percina and Sedera to learn more about the services that you provide. Anything else that we want to share?
Yeah, just find me on LinkedIn. Just come find me. If you want to talk about this stuff, I'll geek out about it with anybody.
That sounds great. Thanks so much, John. Appreciate it. Thank you for tuning in to the HealthCast. That does it for today's episode, and stay tuned for our next episode. Thank you so much.
Thanks for that.